Bonjour, Bois Forte community. My name is Teri Morrison. I'm the community health nurse for Bois Forte. I am doing this video just to talk a little bit about what isolation and quarantine are and what the differences are. So, isolation is when you yourself are sick, where you have symptoms or you've been diagnosed and come in and taken a test and you have COVID. So, if you have COVID or you have the symptoms, and a provider at the clinic, either any clinic, has told you that you maybe have it or you're waiting for results back, we would ask you to stay in your home until you get the results back for sure. If you're negative for COVID, then they will let you leave the house again. But if you are positive for COVID, then we are going to ask you to stay isolated in your home for the minimum of 10 days. And you need to be 3 days fever free, and your symptoms need to be improving. So if you are diagnosed and you live on reservation, you would probably hear from either me or Terry Defoe. We're the ones who are doing the case investigations. We will give you instructions that you and then also your family members, which I'll talk about in a little bit under the quarantine, shouldn't leave the house. So we, as the community health department, we would assist you guys in getting any medications delivered to you, anything you need. We'd bring you some information on what COVID is and when to call for help if you need help. We would ask that if you need groceries or anything, you would contact a family member or a friend to get those for you, because you cannot go to town. You cannot go to the store in Net Lake. You can't go to the Bois store. You really can't leave the house for any reason. You also can't have anyone come into your house. So if you have a family friend or someone that picks up stuff for you, or if we pick up stuff for you, we're going to leave it right on your doorstep, because we don't want to expose anyone else to the COVID, because we want to stop the spread. So then I'm going to talk about quarantine. Quarantine is when you had direct contact with someone that has COVID. What we count as direct contact is any contact that you have with someone and you're closer than 6 feet to them for longer than 15 minutes. So I'll give you some examples. If you rode into town with someone in the same vehicle and you got sick within 2 days of that time, or you were sick during that car ride, then that person that was in the car with you would be a direct contact, is what we call them. So then they would be asked to quarantine themselves, which means stay at home for 14 days from the last date that they had contact with you. So you would be contagious for 2 days before you got sick. So if you started having symptoms, even if it's you lost your sense of smell on a Thursday, so anyone that you had contact from Tuesday through that Thursday where you got any symptoms would be called a direct contact. So either Terry Defoe, if you live on reservation, either Terry Defoe or I would call you and ask you who you had contact with, where you went. If you went into the store and bought a pop and you didn't sit and talk to any of the staff or anyone there, you just went in, you bought your stuff and you left. None of those people that you came in contact with would be a direct contact. We would not be contacting them to quarantine. So quarantine means that just you, so say you live in a household with five other people, but only you had the contact with the person that came down with COVID, just you would be quarantined. You wouldn't want any other people from outside coming into your house because you can't have contact with anyone else. But those other 5 people in your house can still leave the house, if that makes sense. Just you would be quarantined. That's the difference between isolation and quarantine. Remember, isolation is for sick people. They have symptoms, they're contagious. Quarantine is for people that were exposed to someone that was sick, but aren't sick themselves. So just that one person would have to stay home. If the person that is quarantined comes down with symptoms, then the rest of the household would have to stay home for the 14 days. So if you're quarantined, you are quarantined to your house. You can't go shopping either. Like, you can't go to the store, you can't go to Walmart. You can't do that. The same thing applies if you have a friend or a family member that lives in the house that can go get stuff for you, that would be great. If you live in the Nut Lake community or the Vermilion community and you need meds delivered or anything, then you would contact me or the CHRs and we will drop those off. We will not have contact with you either. We will leave it at the door, or with a different family member that isn't quarantined. So you would be quarantined from 14 days from the last time you had contact. That gets a little bit confusing if someone in your house is isolated. So say one of your kids got sick and they have COVID and you're sitting at home taking care of them. If you're sitting at home taking care of them, you are in direct contact with them until the last day that they're contagious, till they're 10 days. So at that point that they hit that 10 days, that's when you start the 14 days. So you could be home with your sick kid or your sick significant other for 24 days, which is a long time. So that's kind of why we want to really protect everyone and not have the COVID come into the community. We're hoping that we can accomplish that. We're still encouraging people to social distance. I know it's really hard. A lot of people are really relaxing, but if you want to go out and see your friends, I would make sure that you're at least 6 feet, standing at least 6 feet away from them. That way it's a little bit safer. That 6 feet outside is best, because then the air is moving around and you're not in like that stagnant inside air. So that was a lot of information. If you have questions, please comment on the video below and I will do my best to pop in and answer those. If you want to contact me directly if you have questions, my number is 218-750-2227. That's my work cell phone. That's 218-750-2227. I look forward to answering any questions you have, and have a good weekend.